Welcome, everybody, to this presentation brought to you by Sashbear Foundation. I'm Doreen Heidman, and I'm the program manager for Sashbear. We're an organization in Canada, a registered charity, which provides information, education, advocacy, and awareness around the issues of borderline personality disorder, emotion dysregulation, and skills and treatments for those conditions, which are primarily dialectical behavior therapy. This evening, we are very pleased to welcome Dr. Gillian Galen of McLean Hospital, who will be presenting for us this evening. So before we get started, I just want to let you know that this is a webinar, which means that you are not visible. Your cameras are automatically turned off and your microphones are automatically turned off. So even though we are recording this presentation, you will not be included as part of that recording. So you do not need to worry about that. That means that you can get up and move around and eat your dinner and take care of your children while we are having this presentation, and make yourselves comfortable. The presentation will be recorded so that you can watch it later, and it will be posted on our website and our YouTube channel, the Sashbear Foundation. And Kathleen will put those pieces of information into the chat for you to see. I want to let you know also that I'm joined tonight to help support this presentation by Kathleen and Barb, who are two of our volunteers, and they'll be helping me behind the scenes, as well as Lynn Curry, who is co-founder of the Sashbear Foundation. And so what else do I need to tell you? Oh, about questions. So Dr. Galen has planned her presentation so that there will be a few minutes at the end of this to take up some questions that are of broad general interest. You can post those questions into the chat or into the Q&A, and you will find those buttons at the bottom of your screen, probably depends on the device that you're on. So please post your questions. If you wish to pose your question anonymously, you may do that using the Q&A function. And I do need to let you know that we will not be able to address everybody's questions. We have several hundred attendees at this presentation, and so we will be moderating the questions to make sure that Gillian has the opportunity to answer the ones that are most directly related to the content that she has presented today. So with that, I would like to welcome Gillian with us here today. So Dr. Gillian Galen, and you know what, I don't actually even have the pieces of paper in front of me to say exactly what your titles are, but I know that you are involved with the 3 East Continuum at McLean Hospital, and the 3 East Continuum provides DBT treatment, particularly for youth who have emotional dysregulation, and that's a DBT treatment facility. And she is also an instructor with Harvard University, which is also in Boston, and McLean in Boston are, of course, connected with each other. Gillian is well known for her work with DBT in the treatment of borderline personality disorder for youth, for young people. And she has a particular interest, I know, in the use of mindfulness. And she's also spent a lot of time working with families and parents of youth to help support them in their treatment. So I am going to stop sharing at this point, and I will turn it over to you, Gillian. We are so pleased to have you with us here. This is the second time, I believe, that you've come to do a presentation for us, and we're just thrilled that you are here today to help us learn some more about some of these things that are really going to help us in our family situations.
Thank you so much for having me. I love coming here. I'm always so touched when I get invited. So I'm hoping that this will be helpful for everybody. I spend a lot of time working with parents. I used to spend a lot of time working with their kids. Then I shifted to spending a lot of time working with kids and even more with their parents. And I think one of the things that's really challenging is that when you have children or family members who struggle with the kinds of behaviors that bring them to DBT, self-injury, suicide, really difficulty regulating emotions, maybe explosive behaviors, it's really, really hard to set limits. And almost every parent, by the time they make it to me, will say things like, I never would have done this with my other kids. I've lost all my parenting values. And they lose it because of fear. And that fear is very, very justified. And not being able to set effective limits actually has a really negative impact on kids and relationships between parents and kids. So we're going to dive in, and hopefully at the end of this, you will have learned some things. Let's see if this one works. There we go. Okay. So I want to start by just talking about fear. Okay. So fear is one of our primary emotions. There's lots and lots and lots of debate over the number of those primary emotions. I like to think about primary emotions as neurological events, right? There's a stimulus. We hear something, see something, feel something, remember something, and our brain takes in that information. There's a whole bunch of neurons that fire together, and our limbic system, mostly our amygdala, produces an emotion, right? We know that emotions have functions, right? In DBT, we talk about the 3 functions they have: to communicate to ourselves, to communicate to others, and to motivate action. Okay. So fear is one of those primary emotions. We also know that primary emotions can also turn into secondary emotions. Okay. Secondary emotions happen when we think, or we apply our cognitions to those primary emotions. Okay. So for better or for worse, those secondary emotions are the ones that hang around for a long time, right? And they do that because often outside of our awareness, we kind of feed them, we think about them. And fear is a great one, that we have a primary fear, and then we think about that fear, and we make that fear last longer and longer and longer and longer, right? And it makes sense, right? Because that fear is often justified. Okay, so I found this nice quote. Fear is the brain's way of saying that there is something important for you to overcome. Okay. So I want to talk a little bit. I want to give people some data. I love data. And I know for anyone that went to Cynthia Kaplan's talk, she talked a lot about trauma and secondary trauma. But if you take a look at this graph, hopefully you'll feel validated. I think it's also very, can be very surprising. Lots of emotions are going to show up. But if you look at the prevalence of trauma by occupation, right? So we've got social workers, oncologists, people that treat dual diagnosis substance abuse, people that work with violent and sexual crimes, the military, first responders, child protective services, and in the States, we would say DCF. It makes sense, right? That you would think, I think most people, if you lined up a lot of people, they would think like, absolutely, those people work with, in really difficult situations in which they may be traumatized. And then if you head over to the right, you'll see actually you can think about the occupation of being a parent with children with life-threatening behaviors, okay, that either do or do not engage in treatment, okay? And so what you'll notice is, and I think this is often surprising to people at first because they don't think about it this way, but many parents of kids that come to DBT, right, experience their own trauma from having a child, right, that has either engaged in suicidal behavior, thinks a lot about suicide, self-injures, or does other self-destructive behaviors, right? So when we talk about setting limits, of course, fear gets in the way, okay? And again, fear gets in the way at different levels for different people. There is a very, very high prevalence of PTSD, meaning that parents of children that struggle in this way with self-destructive behaviors and suicide actually meet the DSM criteria for post-traumatic stress disorder. So it makes sense, right, that fear gets in the way when we are going to say no, right? Or set limits with kids that we know are going to be upsetting. They may leave them angry, feeling left out, feeling lots of these feelings, and they're kids that sometimes can't manage it, right? Or more times than not, they can't manage it. So just a little reminder, if you want to sort of self-assess and think about, truly your fear as a parent, this is a symptom of secondary trauma, right? These are all of these ones. Hypervigilance, right? So many of the parents that I work with will say, like, I constantly think about, maybe if they have an app, they're constantly maybe tracking their child. They're worried about them pretty much all the time, right? And they're very vigilant. Hopelessness, guilt, avoidance, fear, minimizing things. Some people minimize, some people maximize, like sort of enhance it. Anger, cynicism, poor sleep, being lower immune system, getting sick more, social withdrawal, disconnection, difficulty with boundaries, right? Sometimes, this can look just something as like, I'm so afraid to let my child be alone that I sleep in their bed or they sleep in mine. As teenagers, inability to listen, right? Which often happens, the more anxious we are, the more dysregulated we are, the more we're sort of focused on our dysregulation. Everybody, that's sort of how the brain works. And as a result, it's very hard to really listen and take in information from other people. Diminished self-care. Most parents that that come to work with me have terrible self-care. They've given everything up, right? Because they are so scared that they feel like they don't have any time for it. Survival coping and chronic exhaustion. Okay, so if any of these resonate, it's a great example of that. Absolutely, fear is going to get in the way. Okay. So for people that are familiar with DBT, the first thing that I teach parents who are coming to me to learn DBT skills and get some parent coaching is that you need to tackle your vulnerabilities. You have to, right? Because when fear gets in the way, that means you're parenting in emotion mind, right? You're parenting through those emotions, which is exhausting. And it's not very actually effective for anybody involved. Okay. So the first thing that we need to do, if you want to set effective limits, and I get a lot of pushback sometimes where people tell me like, no, just teach me how to say no and reassure me that everything is going to be okay. And I said, no, we can't actually do any of that until you can find steadiness. Okay. And this is not easy, right? It's just not easy. The reality, it's not easy when things are going well for each other. And it's often not easy when things are going difficult in a difficult way in our life. So the ABC's please skills are the skills that manage our emotional vulnerabilities. Okay. I think about ABC please skills, again, for everybody, for myself too, as like my emotional foundation. Okay. When that foundation is solid, when the hurricanes and the tornadoes and all the emotional weather comes my way, I stay pretty steady. Okay. When this foundation is cracked, I am less steady and I'm less effective. Okay. So the wonderful thing that I think about ABC please skills is that most things in our lives are not, we can't control them. Lots of things happen and lots of things we have little control over. ABC please skills, we have a reasonable, not perfect, but a reasonable amount of power to control some things. Okay. So I usually tell people we've got to get them in balance. Okay. So we need to accumulate positives. This is the one I get a lot of pushback on because, most people will say like, my experience is that I am only as happy as my most unhappy child, right? That's hard, and as a parent, like I get that. Okay. And we have to find positives in our life. We can't necessarily wait for them to happen. I think the reality is good things happen to some people more than others. But what we need to do is have moments, at least, of ways in which we are generating some positive emotions for ourselves. Okay. I mean, this could be going to Starbucks and splurging and buying yourself, your favorite kind of coffee, or for the season, your pumpkin spice latte, right? Or whatever it is, something that you wouldn't have done. It can be going for a walk. Okay, so it doesn't have to be something big, but in order for our emotional foundation to be steady, there has to be some moments of joy, right? Or excitement. And we can generate them. We don't have to wait for them to happen. Okay. We have to have mastery in our life. We have to have things that are challenging other than managing our child, right? Or our loved one. We have to have things that make us feel like we are doing something hard and that we're accomplishing it. Okay. So, I mean, this could be saying I'm going to run a 5K, right? And beginning training. Maybe I'm going to run a 5K in a year, right? Or, this could be a task at work, or this could be learning something new. But we need to have a sense of mastery to keep that stability. And we need to cope ahead. Okay. So we need to think about difficult things, emotionally difficult things that are coming away, and we can plan for them, right? We can also use the cope ahead skill to plan for the worst case scenario. So instead of spending hours and nights staying up what ifing about that worst case scenario, we cope ahead and we say, you know what, as awful as it's going to be, if that worst case scenario happens, how am I going to survive it? Okay. Then you don't need to ruminate about it anymore. So the A, B, and the C are your psychological building blocks of your foundation. The please is the physiological ones, right? So we can treat our physical illness. Like when we're sick, we need to take care of ourselves, right? We are much more emotionally vulnerable when we're sick, and emotionally sensitive people are even more emotionally vulnerable when they are sick, okay? You know, the 3 East residents added a little bit. They didn't like that the P and the L were together, so they added lather, rinse, repeat, right? So in the psychology world, we talk about that as your ADLs. Take care of yourself, okay? Take care of yourself. Shower, get dressed. And then the adults on 3 East added limit screen time. The kids were a little bit less excited about that one, okay? Exercise, like lots and lots of good data on exercise and endorphins. Do something that works. Go for a walk, go on your Peloton, do Pilates, do a yoga class, do some sort of exercise, okay? Avoid mood altering substances or do them mindfully, okay? Sleep is a tough one. I would say for most people, sleep is the one that isn't balanced. Come up with sleep hygiene, do the best that you can to sleep, and also cope ahead for the impact of not having sleep. Okay, I always give the example when I came back to work, and in the US, that's after 12 weeks. It's a little bit better now, but with my kids, it was 12 weeks. I've spent the next 6 months sleep deprived, right? And I just coped ahead for that. Okay. And we got to eat balanced. So think about what you're eating and how often you're eating. Are you getting enough? And are you eating foods that make you feel good? So before we're going to do anything about setting limits, we are going to balance our please skills. This will also help us manage our fear. All right, so now we go into this understanding the principles of behavior. If you want to change someone's behavior, right, and if you want to understand, you got to understand their behavior, right? And what you have to know is that all behavior is learned. We learn effective behavior and we learn ineffective behavior, right? And behaviors all serve a function. They're not random. They do something for us, okay? So if we're thinking about like, why are they doing this? The question is, what function does it serve? It serves some kind of function, right? So if you think about a behavior like self-injury, you think, oh, like, why are people doing it? One of the functions of self-injury is to regulate emotions, right? People will tell you that it makes them feel better. It makes them feel more grounded, okay? So there is a behavior that we say is a problem, but in the eyes of the person that's using it, it's actually a solution. So we got to look at and understand what the function of the behavior is, right? Behaviors continue or increase because they are being reinforced. This is critical. Okay, people will say, I don't understand why they keep doing it. They keep doing it because it's being reinforced. We just have to figure out what's reinforcing it, right? And reinforcers can be anywhere in the environment, and they can also be internal, right? So there are often multiple reinforcers to behaviors, okay? And that we need to remember that reinforcement is the most effective way to create enduring change, right? So punishment exists, it happens, there's natural punishment. But if we want to actually change a behavior in a way that is going to last, we have to use reinforcement. It's just much more powerful. So what's reinforcement? Okay. A reinforcer is anything that follows a behavior that increases the probability that the behavior will happen again. So if everybody like teleports themselves back to the potty training years, right? It's not that far for me. I have an almost 5-year-old. That's how you use reinforcement, right? So most kids, they go to the potty and they would have a reinforcer. Something would happen after they went to the bathroom that made it more likely they would do it again. They got a sticker, they got a high five, they got a piece of candy, they got a toy, in my kid, like a toy car, they got something to put into a box that when they got so many, they got a prize, right? That's a positive reinforcer. So the thing that's really, really important, and if you leave with like one thing, what I want you to understand is reinforcement has nothing to do with good and bad. Okay, this is the thing that throws everybody off and actually makes it really hard to understand. So positive reinforcement is just addition, right? So my son Jack goes potty, right? And he gets a penny. Okay. The next time he's more likely to do that because he wants the penny. Okay. Now that is, I'm adding something after he does the behavior that's making it more likely to happen again. Okay. So we're going to talk about that, right? And negative reinforcement is the removal of something, right, that is aversive that makes the behavior happen again. Okay. This is where everybody falls apart. Everybody goes with like it's a bad behavior. It's a negative reinforcement. It's actually just removing something. I actually happen to think that negative reinforcement is actually a lot of times more powerful than positive reinforcement in terms of behavior change. Okay. So what we need to remember, and this is this is like a key nugget for parents, that reinforcers are in the eyes of the receiver. Okay. So if you're trying to get me to do something using reinforcement and I don't care about the reinforcer, I'm not going to change my behavior. Right. So whether we think it should be a reinforcer is irrelevant. We need to actually find what the people want. What is our kid or our family member or our loved one want that's going to be motivating. Okay. So we're going to start with positive reinforcement. Okay. So positive reinforcement, like I said, is the addition of something, right, that makes the behavior increase or continue. Okay. So it's all about addition. Okay. Now with little kids, you can do kind of prizes and that works. That doesn't work so much as we get older. Okay. But what works are these more common reinforcers, right, for adolescents and young adults, and even adults, are things like freedom, independence, trust, intimacy, right, appreciation, power, right? These are all the status. These are the things that are reinforcing to us, right? So, if I'm working with a family to help somebody figure out curfews, like their child just has a really hard time coming home on time, and I know that he wants a later curfew or she wants a later curfew, that's a great reinforcer, right? So I'm not going to move on the curfew until, if you can come home for 2 weeks at the correct time, then what we could do is we could move your curfew 15 minutes later, right? Sometimes the only reinforcers you need is like a recognition of somebody's hard work, right? So the work is to really think about what's a positive reinforcer that's meaningful to the person. And sometimes you just have to ask. I think often people are afraid to ask, but we sometimes just need to ask, like, what's important to you? What do you want more of? What are you looking for? And then we're going to help you get there in an effective way. All right, here's my little cartoon to mix it up. So shouldn't every day be Employee Appreciation Day? Okay, so sometimes it's just being appreciated and recognized, right? Sometimes it's getting something like we're giving all of our staff a fleece, like sort of a fleece like this for free because in appreciation, right? That is and I know for a fact that is very, very motivating for our staff. So let's talk about negative reinforcement. So negative reinforcement, I want you to think about as relief. Okay. So I want you to think about when you have a headache, right? When I have a headache, I take 2 Advil, right? That works really well for me. I get relief from my headache. The next time I have a headache, I'm very, very likely to reach for the Advil, right? Versus some other type of pain reliever. Okay. When you buckle your seatbelt, so if we all drive in our car and we don't buckle our seatbelt, what happens? Really annoying, like beep, 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 beep. We click the seatbelt, and what happens? The annoying beep goes away. We have been negatively reinforced, right? When kids and adults self-injure, right? That works on negative reinforcement. I feel very overwhelmed, right? I cut myself and I feel better. right? So the next time that I feel overwhelmed, I'm very likely to cut myself again, right? And the challenge with self-injury is that it works very, very, very fast, right? So when we're teaching in DBT, we have to make sure we teach another skill, right? If we're going to say, don't use that behavior that gives you so much relief, I'm going to have to replace it and help you find one that also gives you relief, that's different, right? And maybe isn't going to get in the way of your goals and the things that you need. Okay. So negative reinforcement, there's nothing bad about it. It's all wonderful. It's very, very powerful. Okay. One of the most underutilized negative reinforcers for parents is the removal of nagging. It's amazing what you can get kids to do when you tell them, wow, like if you would clean your room, right, by Friday, because that's the rule in our house that everything is off the floor in people's rooms, then I wouldn't be up in your room starting on Thursday morning, reminding you that you need to clean your room. You would be amazed at the number of kids, not all of them, but the number of kids that will say, like, really, you'll stop bugging me, you'll stop coming into my room, and you'll stop texting me, and you'll stop saying it in front of my friends that I need to clean my room if I just get it done. Yes. Right. Now you have to actually not nag them in order to see if it works. But it's a removal of something that the kids feel is aversive, okay, which is often our nagging behavior. So keep that one in the back, in your back pocket, because it's unbelievably powerful. Let's see. All right, so here's my little cartoon. This was sent to me from a mom in one of our parent groups, which is fantastic. It says, I thought when you said you weren't going to tell me again, you wouldn't tell me again. Okay, so when we're going to use that as negative reinforcement, we actually have to stick to it. Okay. So I talk a little bit about shaping. Sometimes we really want to change a behavior, right? So we have a kid that has been coming home 2 hours past their curfew, and our goal is to help them learn to have the skill set to get in on time. And they go from 2 hours past their curfew to an hour. We use shaping, which is that we reinforce an approximation of the behavior, right? We want, maybe they didn't get it perfect, so maybe they're not getting whatever the big reinforcer is, but they're going to get a recognition that they're moving in the right direction, right? That you're getting close and you're doing, you're really working hard and I can see it. And, maybe, you get a different kind of reinforcer that's not as good. Okay. So sometimes we have to shape the behavior because what we're asking them to do is just really big. Right? We're asking for a big change. Okay. And so we need to help them along the way. So people often ask, what's the difference between consequences and punishment? Okay. So consequence is something that occurs in conjunction with behavior and is connected, right? This might be natural. We know that natural consequences are the most powerful. If I don't study for a test, I may not do well, right? And they happen in the everyday environment, right? Or something that is very connected to the behavior, okay? And we're going to talk about setting those limits and contingencies because the learning comes because they make sense, okay? This is tricky because often I can't tell you the number of parents that have said, like, I feel like the only leverage I have is a cell phone, right? But you end up with just taking something away, right? So punishment. So something desirable is taken away. It's often arbitrary and not connected to the desired learned behavior. Okay. And it happens after the fact. So we really want to think about consequences, right? Because consequences, again, this is where our reinforcement comes in. It creates learning. Okay. Whereas punishment, well, while there's a place for punishment, it's just less effective, right? And part of it is that you can make punishment more effective if you make the punishment match the crime. But often what happens is that we take the one thing that's important away and you get punishment, but you don't actually get any learning of behaviors. So we're going to talk a little bit about extinction. This is the part that scares people the most, and this is the hardest part of behaviorism. Okay. So extinction occurs when you know the reinforcer and you remove it, right? And as a result, the behavior fades out over time because it's not getting reinforced anymore, okay? So I often will work with parents whose kids, when they get dysregulated, say very mean things on the phone. And they don't mean them. It's very emotion minded. They often feel badly about it later, but it's a real problem. And they say very, very mean, very hurtful things, right? And they say like, this is awful. They need to stop doing this. And I will say something to them. How long do you stay on the phone? And they'll say, oh, well, I mean, this could go on for hours. I stay on the phone and then I'll get off the phone and they'll call back. And I say, well, what do you do if they call back? And they say, I pick up. So now we know the reinforcer, right? We know one of the reinforcers. One of the reinforcers of the behavior continues because there's something that happens around the connection and keeping up the conversation. I can tell you from working with kids on the other end is that there's often a release that is a reinforcer. Like there's some kind of emotional release that happens. And so they continue to do it until they like sort of quote unquote feel better, which takes often a very, very long time. And we know that this kind of venting actually only kind of fuels the emotional dysregulation, but it feels good enough in that moment that it continues. And we know the reinforcer is the staying on the phone, right? Because it allows them to vent to someone, which is part of the reinforcer. Okay. So if I'm going to put that behavior on extinction, what am I going to do? I'm going to tell the parents, like, you're going to tell them, and we tell kids before the moment happens. When you're on the phone, the first time you swear or yell or whatever that behavior is, I'm going to just do some validation and let you know that I'm not, the next time that happens, I'm going to hang up the phone and we need to take a break for an hour and then we can try again. And if you continue to call, I won't be answering until it's been an hour or whatever. There's all sorts of different versions of this. What happens then is you get what's called an extinction burst, okay, which is a very natural thing that happens, but it's very, very scary, okay? So what happens with an extinction burst is I've removed the reinforcer and we are people of habit. We just are. So we expect the same thing to happen over and over again, even if we were fully oriented to it. It's just how it works. And it would happen with all of us as well. And especially if you're emotionally dysregulated. And so what I'm going to do is I'm going to get louder and I'm going to call more and I'm going to press you more to make you go back to your old mom or dad or sibling behavior, which is staying on the phone for as long as I need you to stay on the phone. Okay. So this is our little warning, is that this is the burst. So what happens is the behavior that you want to extinguish gets worse. Okay. So it gets worse and worse and worse and worse. And you're like, oh my gosh, I get called, Gillian, this is not working. And I say, just hang in there. Okay. Let's think about what we need to do. We can use validation. We can use your own distress tolerance, but hang in there. So what happens with the burst is the behavior goes up and up and up. It gets worse and worse and worse. It gets louder and louder. And if anybody's had an experience where they gave into like a toddler or a little kid at a grocery store or a toy store, and then they didn't the next time, you probably got a burst. And then what happens is that if you stay steady in your response, the behavior will plateau for a little bit, and then it will diminish. And you may get a little spontaneous recovery, but you just stay the course, and the behavior over time will diminish. Okay. This is the time when parents need the most support. Okay? And sometimes behavior cannot be extinguished sort of outside of a program or a hospital, or, working really closely with sort of multiple therapists or in-home support, because sometimes the burst, what has been reinforced, unfortunately, right, and happens honestly for lots of people, is that some sort of suicidal or self-injurious behavior has inadvertently been reinforced, meaning when I'm doing a behavior and I'm dysregulated and I say I'm going to cut myself or I'm going to kill myself or I do cut myself, then we go back, right, to that old way of being. And we get stuck and we can't extinguish the behavior, right? Because we get scared. And in fact, we've reinforced it, right? It says like, when the escalation is very, very high, I will back down and I will go back down to doing what I'm doing, right? I will not say no. I will give in. I will, remove whatever expectation I had, whatever it is, right? So that is in DBT that happens, and it happens because of course we get afraid, right? So some behaviors are easier to extinguish than others. And you need to remember that you need support, because if you give in when the dysregulation is at its peak, unfortunately, you have reinforced that if I get dysregulated enough, I can get you to go back to your old ways, right? And, is it the end of the world? No. It just means that you have to start over and expect a higher extinction burst, okay? Because for whatever reason, when these kinds of things have been reinforced, it's almost like there's a 99% chance you're going to stick with the plan, but they're going to go for the 1% if you have deviated. And and in no way is this in people's awareness. I think people often say, oh, they're so manipulative. It has actually nothing to do with a lot of like conscious thinking. This stuff works on a very, very, very primitive basis, right? And emotions are high and they work more with desperation. Okay. So now we're going to talk about contingencies. So contingencies work only when you really understand these principles of behavior. Okay. And what I want you to think about is that contingencies aren't random. Okay. We like to think about contingencies build capabilities. Okay. So there is some sort of skills deficit, or there's a new skill you want your child or your loved one to reach for. You realize that maybe you have been inadvertently reinforcing problematic behavior. Maybe it's often on that dialectic of fostering dependency and forcing autonomy. That's often where we get stuck with kids that struggle and have deficits, have anxiety, are depressed, struggle with a lot of self-destructive behaviors. That's dialectic gets us stuck, right? And sometimes we are inadvertently fostering dependency, and we get kids that are missing out on really important skills. Okay. So this is a really neat acronym that my friend Jim created around thinking about like, how do you set these expectations for kids or even adults or loved ones using this idea of contingencies. Okay. Now, the way a contingency works is that I'm going to teach you to do a new skill, right? For example, I need you to come home on time. Okay, we'll go back to that example. I need you to come home on time, or, I need you to do the dishes. I mean, you can really pick anything. Or I need you to talk more in family therapy, right? You can pick any of these things. And if you are able to do that, right, whatever the desired behavior is, you will get the reinforcer. Okay. If you are not able to do it, you won't. Okay. And this is what's really different and can be actually quite challenging, because people want to move into punishment, right? We get angry, we get scared, we get disappointed, and we say, you didn't talk in therapy, and so you lose your cell phone, right? Or something like this. You're not participating in your treatment. You're not coming home on time. And so you lose something. That's punishment, right? And that's not what we're looking for. We're looking for consequences that make sense around a behavior. So we want to think about, number one, you want to ask yourself, what is the behavior that I want to help this person with? So what do I want them to do more or less of? Okay. And the beauty of contingencies is it also really helps with non-emotion minded parenting, right? So I think the hardest thing for all of us, and we've all done it, I have done it. My husband always laughs when I do it. He's like, thought you understood this stuff. You teach people this stuff. Okay. So we all do it. We get into emotion mind and we make a parenting decision. And mostly when we get out of emotion mind, we're like, I set a limit that I cannot, like I took the car away for a month and now I have to drive, I need to basically do, 7 hours of driving a week, which I kind of can't do. Okay. And then we really lose, we lose that self-respect and we lose our credibility around setting limits. So the first thing you want to think about is, what's the behavior that I want to help them do more or less of? Okay. And then I'm going to set a contingency plan outside of the moment of them doing it. Right. So I'm going to think about this plan. It's not at all reactive. And the beauty of it is when the kid does or does not do the behavior, you don't have to think at all. Okay. You go back to the shared contingency. Okay. So the acronym is cliche, Okay. And what you want to think about is you need to be consistent. Okay. And this is the consistency falls apart almost like instantly in emotion mind because we get very reactive and we sort of go with like the first thing that comes to mind. Okay. We want to be consistent in our expectations. Okay. We want to figure out what's the reinforcer, and we want to be able to follow through on applying the reinforcer or not applying the reinforcer. Okay. So, if you can come home on time for 4 weekends, I will increase your curfew by 15 minutes. If they come in on weekend 1, 2, and 3, but they miss 4, we just wait until they get the 4th one. Okay. So they're reaching for something, and we're going to stay very, 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 very consistent, right? And if that reinforcer matters, okay, they'll keep reaching if we've got the right one, okay? And we're going to, we'll talk about being collaborative. So we're going to be consistent. They have to be livable, right? This is the next thing that goes when we do it in emotion mind. We take the car away and then we can't actually live that way, right? Because we need them to drive themselves to activities and drive their siblings, right? So we need it to be livable for everybody. Okay. So, right. Don't take away the cell phone if you need them to have the cell phone so that you know where they are. Okay. So really sit down and make it livable, right? Make something that is livable and that makes sense. Okay. Make it intuitive. That's as your eye. Okay. So, if you're going to use punishment, it has to fit the crime. Okay. But the rewards need to make sense, right? So coming home on time for the curfew, if they want a later curfew, the reinforcer of increasing the curfew is intuitive. Okay. It makes sense, right? You could probably, you could think about that generalizing outside of just a curfew, right? That has to do with building trust, being reliable. Okay. When we are more trustworthy and reliable, we tend to get more freedoms. Freedom is a very powerful reinforcer for most people. Okay. So be thoughtful and make it intuitive. Okay. It's got to be collaborative. Okay. So contingency plans, everybody sits around the table and figures this out together. Okay. So there's no mystery. There's no imposing. There's thinking about and negotiating and collaborating. Okay. Collaboration helps you understand what reinforcers are important. It might help you understand some of the barriers. Okay. It also means that when the person comes home 15 minutes late and misses the curfew, everyone knows what's going to happen. Everyone knows, right? They missed the reinforcer for that week and they got to keep trying. Right. So everybody knows what's happening. Okay. And you make these things holistic. You can tell, the therapist can be included, teachers, family, friends, whoever makes sense. We want it to be collaborative and holistic. Okay. And the last thing is we want it to be established. Okay. This is the thing that will help the most, which is that you create these contingency plans, right? Outside of the moment. Everybody knows about it. Some people like to write them down and keep them posted. Some people put them on their phones. Other people don't. But it's an established plan. Everybody knows about it. Now, they don't have to be happy about it, right? I think this isn't an acronym that's going to get everybody happy all the time, although people tend to do better, and the kids and the family members do tend to do better when they know what's going to happen. Okay. And in those moments, when you have to say, okay, you're 15 minutes late, you've got another weekend to come in on time, you can focus less on having to figure out what to do and more about managing your own emotions, right? Managing your own emotions, managing fear, accessing support, and whatever you need in those moments so that you can stay steady. Okay. So again, as you set your own contingencies, remember the reinforcers, okay? And remember that you may have extinction bursts. Like sometimes we'll have contingencies and, they won't follow through, right? And there'll be some kind of natural consequence, like, that, they're not still not coming in on time. And now there's a party that everybody's going to, and they're going to have to come home, at the same time, right? Or they're going to miss out on something. So hang in there. And then if contingencies aren't working, if this isn't working, you go back to the table and you start to figure out maybe the reinforcer isn't strong enough. Maybe it doesn't feel collaborative enough. Maybe you need to do shaping because you're asking them to do something that's a little bit out of reach. This is your tool to trying to figure out, how do you set those limits? How do you set those expectations, right? And, for those of you that know DBT, you can use these. This is where you're also using your give and your fast skill. Okay, so this is recognizing how hard it is, saying what they need, and then talking about what your contingency plan is. All right, so that was a crash course in behavioral principles and contingency management, and I think I left enough time for some questions.
Thanks, Gillian. I feel like I'm back in my Psychology 101 class, and I didn't get any farther than Psychology 101 because I think it was the behavioral principles that just totally fried my brain.
It's tricky. It's a little tricky. Yeah.
I don't know. It's sort of like algebra applied to real people. And it just really, really, I found it challenging. I still find it challenging. That helped a little bit, but I know I can see from the questions coming in that people are still struggling a little bit with the abstract nature of this and how to really apply it. Could I maybe get you to stop sharing your screen so that we can see your face a little better, and then we can talk a little bit about some of these other things. So I want to backtrack a little and say, okay, first of all, what types of situations is this appropriate to deal with? So you gave the example of coming home late. But maybe we're talking about things that are a little bit more serious, or maybe a little bit more values-based. Some of the examples that have come into the questions are things like substance use or self-harm. Are these appropriate behaviors for parents to begin to apply this kind of thing? Is it reasonable for us to set limits around them?
Absolutely. So, I think contingency management is huge in the world of substance abuse treatment and dual diagnosis treatment. And, it can be very, very powerful. So often people will set contingencies around living in certain houses, right? Like, if you're going to live in my home, these are the things that I need, right? So some people might say, I'd love to have you here. And if you're going to live in my home, what my expectation is drug testing. And as long as you have a clean drug test, this is the outcome. You stay in my house. And when you have a positive drug test, this is the outcome, right? Which could be an agreement that you go to treatment, which could be that you move to a halfway house, which could be whatever whatever you holistically, decide. And it's not always like we're going to meet with the perfect compromise. It may be that, like, this is my limit. And again, if you think about the capability that you're trying to enhance is sobriety. Now, if you have somebody that's not interested in sobriety, it's probably, and you need them to be sober in your house, then contingencies also help you realize that that's probably not going to work. Right. So, so absolutely. You can use these kinds of contingencies around kinds of communication. If people have examples like, how could I use it with this? Then, I can talk with you about it. But substance abuse is a huge, in the world of substance abuse, contingency management is huge. And what happens is that we often inadvertently reinforce. So family members often inadvertently may reinforce substance use by there's a whole list of things that people do because they are afraid and because they love them, which is like, they give them money, they let them stay in their house, they support things that sort of either directly or indirectly support substance use.
So can we just maybe explore that example a little bit further, and maybe sort of pin it down to something that's a little more specific? So say I have a 15-year-old who's going to school, grades aren't great, but, they're at least engaging in that activity. But they're smoking pot. They smoke it at home. I don't like that. I don't like that they're using it. I believe that they're using it as, this really kind of maladaptive way of managing their anxiety. And I'd rather that they engage in treatment. So, maybe go to therapy, which they're kind of saying, no, I don't like that. Weed is helping. That's good enough, mom. So how do I begin to find my way into this, to figure out what are the things that I want to positively reinforce? How do I use negative reinforcers? How do I use these contingencies and consequences?
Yeah.
I almost feel lost in trying to map out my way into this.
Yes. And these are hard. And somebody somewhere in the questions, it just popped up and then disappeared, said like, who do I go to help? And I think that's therapists or behavioral therapists are great at sorting this thing out, because now we've got this kid that's smoking pot in my house, and you can't make him do anything, right? You can't make somebody go to therapy. Making someone goes to therapy often ends up with a person who just sits there quietly, doesn't say anything, So, I think the first thing you have to think about is, number one, what function does the smoking pot serve? Is it social? Is it coping? Is that maladaptive coping, that it's helping reduce anxiety? Is it reducing maybe social anxiety? So I can get to, I smoke weed before I go to school. I'm less anxious. I can get to school. I can participate in school. Is it distress tolerance when things happen? Like, that's the first thing we need to understand. Is it like that I just like it? Maybe like I just think I like it. The first thing we need to really think about is like, what's the function of that? Right? Because if we say, if we think like, oh, the function is managing anxiety or depression or maybe social anxiety, right? Then we need to think about, number one, are they motivated to get help with that? Right? Like, what are the ways in which smoking weed is a problem? Right? And what is the way in which we might be supporting it? For example, like, are we giving an allowance that's allowing them to purchase it? Or, then again, like, are they working in a job? Right. So you have to start like, and this is where you pull these things apart. Like, what's the function of it? Right. What are we doing that might be reinforcing it? Right. And you sometimes have to go way back. Like, what are we doing? Like, okay, why we're allowing it? If we're not going to allow it, are we going to have them say they can't do it in the house? Well, then can they do it in the property? And some people are saying, well, if they're not doing it in my house, then I'm scared, because where are they going to do it? Right. So maybe that's not the contingency that I want to set. But what are they motivated to do? What do they want? Right. How can I link the two things together? Like, maybe they want more freedom of some sort. They want to be able to do some sort of activity or hang out with kids or do sleepovers or do things like that. And I'm going to say that, like, that's not going to happen until, we can help you manage your anxiety and that you're not smoking so much weed. How are we going to know they're not smoking weed? We're going to drug test them. If we drug test them and they are clean, what's the reinforcer? Like, why should they do that? So then we have to talk with them about that. And then if they're not at all motivated to do anything, then we have to start thinking about, where is our limit? Right? What is the limit that we can tolerate? And if we can't tolerate it, what are our options? But it's very, very hard, especially when we want kids to change behaviors that they're not interested in doing, because the behavior is very reinforcing. And things like smoking weed, multiple reinforcers that are extremely powerful, like it can have a social component. Yeah. It can have a mood component. It can have like a culture component, like they can sort of be in the sort of like stoner culture. So you actually, before you could, you have to start to pick apart all of these different things. But the most important place to start is to think about, what is the function and how might I be contributing inadvertently to this behavior continuing?
Thanks. Yeah, I was thinking definitely about peers as being like obviously they're really likely to reinforce. And then you mentioned all these other things that I hadn't even thought of. So that sounds a lot like like we need to do a lot of work ourselves,
Yeah.
outside of the context of the situation to understand it better. And then hopefully we want to be able to talk to our loved one about the behavior and find ways that we can reinforce it, right, through these to reinforce the change through these mechanisms. So one of the questions that came in was, how do we even reach a point where we can have this conversation with our child?
Right. And this is, this is the challenge, right? Some kids will talk to you about this because they're motivated. They can't figure out, they know they have a goal. They want something, like they want to be able to graduate high school. They want to be able to get to school or do well or be on a sports team or something, and so they may be much more engaged with you to have a conversation because you have a shared agreement of the problem, right? If you don't have a shared agreement of the problem, often parents need to do a whole lot of work on understanding these contingencies and these reinforcers. And then, you may have to engage like a family therapist or a parent coach or someone that's going to help you have this conversation with the person, which is sort of going to look a little bit less collaborative sometimes, and to say like, this is what is going to be happening. Like, this is what we need. This is the capability that we need to see. And they may not be on board as much, though you may be able to get them on board with some of the reinforcers. I think another question that came in was like, what if my child only self-harms? I think the most important thing to understand with the self-harm is what purpose, what is the function of self-harm? And typically it's negative. It's almost always works on negative reinforcement, right? Which is that it provides relief from intense emotions, right? Or relief from numbness and not feeling anything. So it either upregulates or downregulates. So we need to understand that like they're not just doing it and they can't just stop, that they are regulating their emotions this way. Sometimes it's positively and negatively reinforced, meaning that I cut myself and I feel better, whatever better is. Like I feel emotionally better, I feel relief, I feel calmed down, I feel more grounded, and I have a physical manifestation of my pain that other people understand, right? And so now we start to get into, and again, and maybe I understand it that way. Like I understand that my pain is real because I can see it and other people can see it. And that when I self-injure, the environment responds in a different way, right? And so then we go back and we think about, oh, okay, am I inadvertently reinforcing self-injury, right? Or is there something with our communication that we could build some more skills so that instead of, distress needing to be communicated and modulated by self-injury, I can increase my validation skills. I can be more curious in times of outside of self-injury than I am in self-injury, right? Because often what happens is self-injury for people, that self-injury is a way of communicating distress because they don't have the words to do it. Like they just don't have the emotional vocabulary to articulate it, right, to themselves or other people. But they know that if they have that physical manifestation, that people will understand their suffering. And then that's how we understand their suffering. We're going to reinforce it as an effective way of communication, right? Versus us getting curious and validating and helping them try to articulate to us what is upsetting them or what their distress is, right? And then we think about, why don't they communicate to us? Well, maybe we're doing so. I often will tell people, okay, if kids aren't communicating to you, to therapists, to parents, we're probably doing something that's making it hard. So what might we be doing? So you have to understand and this is why it's so important to really understand those principles of behavior. Once you understand those principles, putting a contingency plan together becomes less scary, right? So if somebody's motivated to not self-injure and you can understand all those reinforcers, right, then you can think about, okay, how can I support you doing that? What is the reinforcer that's going to help you in that moment of, I have a very high urge to self-injure? Think, wait a minute, no, I have to use a skill or skills or call for help or ask for help because this reinforcer is important, right? And for some people, it's just counting days. Some people are very motivated to see how many days that they can go, right? Or again, more independence, or I'll check on you less.
Okay, thank you. That was really helpful to me. I'm wondering, a lot of the questions too are now coming in around the idea of when we want to apply this principle to an adult rather than to a youth or a child, right? So maybe it's a partner, or maybe, you know, our children are grown, and so we're dealing with an adult, and we still want to be able to, essentially we're affecting change and impacting their behavior. Is that something that's realistic that we can do with another adult? And is it the same principles? And does it not feel manipulative? And
so the principles of behavior are universal. They affect us all, right? They affect us all the time, right? So I mean, even like on a Zoom, like every time, Doreen, you nod, it's reinforcing me, because it's like, oh, okay, so I'm saying something that means something, right? So like we're constantly essentially reinforcing and punishing each other, right? We don't mean to punish, but like, you know, if you looked away and looked down, right? And then I'm going to change my behavior to do something to get you do that other thing, nodding and being engaged, that feels more reinforcing to me. So, you know, I think, you know, people will say, oh, well, it sounds kind of manipulative, or it's bribing. It's not actually about bribing. It's about building a contingency, right? It's about building a capability. Like they need to do something different because it's related to their goals and it will make their life better. Sometimes we have to do a lot more work on that, and sometimes we don't agree. And this often happens, you know, this happens a lot with substance abuse. This is the problem with mood altering substances, right? Is that they make it very hard for people. I mean, addiction makes it very hard for people to hold on to their long-term goals. And that can be some of the most painful experiences for people. But the other thing to remember, just a little soapbox on manipulation, it's an interesting thing because we often use it in a very pejorative way, but all manipulation is getting somebody to do something that we want. And we do it all the time, right? Like you want people to sign up for the webinar, so you advertise it, right? Like that's manipulation, right? If you advertise it more than once, now essentially you're manipulating me. You're reminding me, you're saying like, you know, come to the webinar, do this, you know, do this. Like we get people to do things all the time. Like I know for my kids, at least right now, because they're young, like I can get them to clear the table, because when they do, I really appreciate it. I'm like, oh, you're making it so, this is so helpful. I love that you can do this now. It's such a grown-up task. And like, you know, right now they're in that little zone where that like feels empowering. That'll be gone very soon. But then I'll have to think about a different reinforcer. But so it is true. Like whenever you are using reinforcement, we are trying to get somebody to do more of what we want them to do. And often with our loved ones, if we're doing it using contingencies, we're doing it because we think it's in their best interest. It's in their best interest. It's in the best interest of our relationships. It's in the best interest of them, of their own goals. Like for kids, for people that avoid school and avoid work, you know, adults that avoid work, kids that avoid school, a lot of times those kids want to graduate school and they don't want to get fired. That's nobody has a job and says like, oh yeah, like I'm good to get fired. Like that's not what they want, right? So we have to set, you know, we often will set contingencies. Now, some of them are natural, which is great. If you don't study for a test, you're probably not gonna get a good grade. Now, people certainly have had kids that, and this always happens to these subset of kids where for a really long time, they don't have to study for tests and they still get A's, right? So now we've reinforced that not studying gets you an A, and then they get a really hard teacher. They don't study because they've been reinforced not to, and then they fail their first test. Well, they'll study now, right? Because it's a natural consequence, and they'll be like, oh, something has changed, right? Now I have to change my behavior. So you could say that that is manipulation too. They fail, and now they have to change, you know, we have to get them to change their behavior if the grades are important to them. Right. You know, so this works for everybody. The more collaborative and holistic you can be, especially with adults, the less manipulated they will feel. Right? Because good manipulation means the person doesn't feel manipulated. Right? That's like, and that's often the everybody. It's funny because the people that I see that will say, oh, they're so manipulative, it's just because they're not effective manipulators. Like, I'll just teach them how to be more effective. You need to get the people to do what you want and have them not feel like that awful, manipulated, duped, pejorative feeling.
Right. And there is that fine distinction where, really we apply that sort of negative judgment to the idea where, we may be feeling like we're trying to get them to do something they don't want to do. And so what you're talking about is finding a way to align it with their goals and what they do want. So it is in their best interest. We have their best interest, and they recognize that it's in their best interest too.
Yeah. The most powerful way to change someone's behavior is to use reinforcement and help them see how what you want them to do is connected to their long-term goals. Right. Now, that's hard to do with people that are very depressed, that lose a sense of long-term goals, right? That can be part of a symptom of depression. But the way to get people to change is to say, like, well, when you change this way, it's going to get you towards what you want. And that's a reinforcer. Some people just, the reinforcer is too far away, right? So if like a 13 or 14 or 15 or 16-year-old saying, like, I want to go to college, but they're having social anxiety and not being able to get to school, college is too far away. Like, that feels like decades for them, right? So we got to figure out things that are reinforcers that are closer and set a contingency plan with the idea that we'll hold that there too, but they need reinforcers that are closer in their contingency plan.
I'm looking at the time, and it's already 8:07. So I don't want to keep you longer. I'm wondering if there's anything that you've seen in the many questions floating past, or anything that's kind of come up out of what you may have anticipated, the types of questions, or anything that you would like to address. One more thing very quickly before we close, because I don't want to, I think we could be here all night.
This is a long one. I probably should have asked for a little longer than an hour, because I think this usually leaves people the first time like, oh my God. I think a whole bunch of people wrote about social media. I have a whole soapbox on social media. I think it's very tough, and it works completely on reinforcement. So I think when you zoom out, now that you understand reinforcement, hopefully, as we manage this with our kids, we have a lot of compassion for how stuck they're in, how stuck they get, because and if anybody has seen the Netflix documentary on Facebook, it talks all about all of these things are for likes are to reinforce you, notifications are to click to get you to go back in, comments, all these things. TikTok is like full of this, Snapchats, like they all work on principles of reinforcement that get people sort of addicted to that stimulation and that need for like immediate kind of gratification and recognition, and absolutely has led to increase in depression, anxiety, and suicidal ideation, particularly in girls. And it's particular to girls because girls are more on they're more on the social media platforms, and boys tend to be more on the gaming platforms. Mm-hmm. So you get a little bit of a difference. The question that's come up a couple of times, maybe it was the same person, maybe not, is this idea of why is my kid not communicating? So what I would tell you is be very, very, very curious and start to think about what are the things that they bring to the interaction and what are the things that you bring to the interaction, and how may you be inadvertently reinforcing non-communication. Okay, so you can think about when you do certain things in your communication, what is the impact, right? Now, they may be also reinforcing non-communication in you. I mean, this is so it's bi-directional. So it's not like it's all parents' fault or all the kids' fault. It's transactional, right? We're constantly impacting, right? So sometimes probably the most common reason that kids don't talk is one, they don't have a vocabulary for their feelings, and we ask them how they feel, and that drives them crazy because we're pressed, because we're anxious and we're worried, and we ask them how do they feel, and they don't know how to answer us. They don't have a vocabulary, so they get frustrated or angry or shut down. Many times, probably most commonly, is there's not enough validation, that we lead with a lot of problem solving and we offer a lot of unsolicited advice because we're good at it and we have good advice, and it's probably the right advice. More times than not, it's the right advice. but we don't validate first, right? And so they don't feel understood. And when people don't feel understood, they don't talk so much. They don't share. And in general, adolescents do not like unsolicited anything. They do not like unsolicited advice. Young adults don't like it. Sometimes adults don't like it. A lot of people don't like unsolicited advice. So what I would tell you, here's a great little communication hack. Don't do it. And just ask people. It's like remarkable. Simply asking someone, do you want my advice, my thoughts, my opinion, whatever? Do you want that? Would that be helpful? Just asking that often opens them up, and they might actually say yes. Whereas if we just offered it to them, they wouldn't. So look at some of your what you can do is you can look at your side of the communication. They have to look at their side. So get really, really curious if your child isn't communicating with you. Maybe they don't have the vocabulary. Maybe I'm offering too many solutions or problem solving. Maybe I'm not validating enough, or I'm not curious enough. Those are really the reason why kids aren't communicating. And they're actually pretty easy fixes, which is kind of neat. Sometimes I'll work a lot with validation, and then parents will be like, oh my God, they talk to me, like totally surprised. And I'm like, there you go. You found it. Awesome. Like now you've got it. So now do more of that. Right. So do more of what works and do less of what doesn't. And there's your reinforcer.
Yeah.
People feel reinforced when they feel like they're understood and we're curious about them. Right. So again, there it is right there. So, oh my gosh. And what do we get with validation? You get 2 behavioral indicators when your validation has landed. They talk more and the emotional intensity goes down. Right. And then look at that. Now you're reinforced because they're now talking to you. So now you're reinforced. So now you're more likely to do, right, what's going to get you what you want, which is communication and connection. So there it is.
Great. Thank you. We are going to end there. I think it's lovely that we can end on the idea of validation, because we talk so much about validation, and here we are again. It seems to weave its way into everything. Thank you all so much for having been with us tonight. I want to just let everybody know, if you want to save the date in your calendar, Gillian will be back with us again in November. I think November the 9th was the date that works. So Gillian will be back as well with her colleague, Dr. Blaise Aguirre, for another presentation on a different topic, more conversational in nature, and that will be on the evening of November the 9th. If you would all like to mark your calendars for that, and information will be forthcoming. Gillian, thank you again so very much for having been with us this evening. This was really interesting, and definitely I need to go back and rewatch it so I can start to understand the theory a little better. So the recording for everybody will be posted on our website once we get it cleaned up a little bit, and on our YouTube channel. And if you would like to request the slides from Gillian's presentation, please email programadmin@sashbear.org. And I'm pretty sure that's been put into the chat a few times. I'm really sorry we couldn't get to more questions. And I'm sure that people have taken away a lot and will take away even more when they get to watch it again in the recording. So thank you once again, Gillian, for being with us.
Thanks for having me.
Great. Good night, everybody.